Hello and welcome to my channel. In this lecture we'll continue our talk about the extensor compartment, the vessels and nerves. So let's begin. The vessel of the anterior compartment is the anterior tibial artery. As you know, it's a branch of the popliteal artery. It ends at the lower border of popliteus by giving the anterior and posterior tibials. The anterior tibial passes anteriorly through the interosseous membrane and between the heads of the tibialis posterior to becomes in the extensor compartment. Descends anterior to the interosseous membrane and passes between the malleoli, and once it passed between the malleoli, it changes the name to Dorsalis pedis artery. First, high up, it was between the tibialis anterior and the extensor digitorum longus. Then, as you know, the extensor hallucis longus originated between the two muscles. So now it became between the extensor hallucis longus lower down and the tibialis anterior. Further lower down, beyond the ankle joint, the extensor hallucis longus crosses it from lateral to medial, as you can see here. Okay, crossed by the extensor hallucis longus. The artery becomes between it and the first slip of the extensor digitorum longus. Did I say crossed by the extensor digitorum? No, it's crossed by the extensor hallucis longus. And now the artery becomes between it and the extensor digitorum longus. It's accompanied by venae comitantes that later on will form. It's considered the deep system of veins, and it will form the popliteal vein with the posterior tibial venae comitantes. Okay, the deep peroneal nerve is lateral to it in the extensor compartment. The deep peroneal nerve is lateral to it. Branches of the anterior tibial gives, of course, muscular branches, gives the anterior tibial recurrent back to the genicular anastomosis. Remember the anastomosis around the knee joint. Gives also the posterior tibial recurrent, but please pay attention. The anterior tibial recurrent, I was asked about this, a multiple choice question. The anterior tibial recurrent arises in the extensor compartment, while the posterior tibial recurrent arises from the anterior tibial artery while still in the flexor compartment. Okay, so if it gives a branch in the flexor compartment before passing through the interosseous membrane, and then after passing from the interosseous membrane, it gives the anterior tibial recurrent. Gives anterior medial malleolar artery proximal to the ankle joint, passes deep to extensor hallucis longus and tibialis anterior, then joins branches on the medial side, which are branches from the medial plantar and posterior tibial arteries. The anterior lateral malleolar on the lateral side passes deep to the extensor digitorum longus and peroneus tertius, then anastomose with arteries on the lateral side, like the perforating branch of peroneal artery and branches of the lateral tarsal artery. Okay? To summarize the anastomosis around the ankle joint, it's a network around the medial and lateral malleoli. Medial malleolus, medial branches, so anterior medial malleolar, medial tarsal arteries, malleolar and calcaneal branches of the posterior tibial and branches of medial plantar artery. Around the lateral malleolus by anterior lateral malleolar from the anterior tibial, lateral tarsal, perforating and calcaneal branches of peroneal and lateral plantar artery. The dorsalis pedis artery. It's a continuation of the anterior tibial beyond the ankle joint. It passes anterior to the ankle, the capsule, the talus, the navicular bone, so it's on the medial side. Middle cuneiform, between the heads of the first dorsal metatarsal. Passes between the heads of first dorsal metatarsal, and here against the navicular you can palpate the pulse. Right lateral to the extensor hallucis longus tendon. Okay? Lateral to the tendon is the pulse for the dorsalis pedis artery. Once pierced the first dorsal interosseous, it becomes in the plantar, in the sole of foot, completes the plantar arch and gives first dorsal metatarsal artery before piercing. In the sole, it may give the first plantar metatarsal artery. Superficial to the artery are the skin, fascia, which is loose fascia, inferior retinaculum, and extensor hallucis brevis. Remember the extensor hallucis brevis, part of the extensor digitorum brevis. Medially is the extensor hallucis longus tendon. This is your guide to feel the pulse, and go at the level of the navicular and feel it. Laterally is the medial tendon of extensor digitorum longus and medial branch of the deep peroneal nerve. Deep peroneal nerve. Okay? Don't count on the drawings, please, because they are not accurate. Okay, especially in the relations between the vessels and nerves. The artery lateral to it is the medial branch of deep peroneal nerve, not like as shown here. Okay, branches of the dorsalis pedis artery, lateral and medial tarsal arteries. See, this is the lateral tarsal artery. These are the medial tarsal branches. It's not one artery. Arcuate artery, the one you see here, level with the bases of the metatarsals, gives 2 to 4 dorsal metatarsals. You know, the first dorsal was directly from the dorsalis pedis, gives 2, 3, and 4 dorsal metatarsals that will split at the whip space between the toes. Gives the first dorsal metatarsal, gives the first plantar metatarsal before completing the plantar arch, and lateral tarsal deep to extensor digitorum brevis, medial tarsal branches. Dorsal and plantar metatarsal branches communicate by proximal and distal perforators. The perforators, one proximal and one distal, pass through the interossei. Perforators, remember, proximal perforator and distal perforators between the dorsal metatarsals and the plantar metatarsals, the one you see here. The veins, dorsal venous arch on the dorsum of foot. Medially, it gives rise to the medial marginal vein that will become the great saphenous vein, passing anterior to the medial malleolus. Please pay attention. Anterior to medial malleolus, while the lateral marginal vein passes posterior to the lateral malleolus to form the small saphenous vein or the short saphenous vein. Now about the nerves, the common peroneal nerve, remember it was alongside the tendon of the biceps femoris muscle, and then it curves around the neck of the fibula, and while there, deep to the peroneus longus, it gives the cutaneous nerve of calf, the lateral cutaneous nerve of calf, that supplies the front, back, and lateral side of the proximal skin of leg, then divides into superficial and deep peroneal nerves. Remember in the knee joint, the common peroneal nerve gave the superior and inferior lateral genicular nerves, accompanying the superior and inferior lateral genicular arteries, branches of the popliteal artery to supply the knee joint. Remember the tibial took the the greater part, superior medial, inferior medial, and middle, while the common peroneal, superior lateral, and inferior lateral. The lateral cutaneous nerve of calf, as I told you, it supplies the anterior and posterior and lateral skin of proximal leg. And also the nerve common peroneal gives the sural communicating that unites with the sural nerve, the branch of the tibial nerve, and then go to the lateral side of the foot and the little toe. Sural nerve. Okay. The deep peroneal nerve, the one you see here, this is the deep peroneal nerve. Lateral to the anterior tibial artery. At ankle, it gives lateral branch and the medial branch. The lateral branch crosses the tarsus and forms a pseudoganglion. It's not a ganglion, it's a gathering of the nerve branches at certain area under the extensor digitorum brevis, and it supplies it as well. Also supplies the tarsal joints and metatarsophalangeal joints and the medial 3 toes and the second dorsal interosseous muscle. This is the medial, this is the lateral branch. The second dorsal interosseous muscle. The medial branch is lateral to the dorsalis pedis artery and gives supplies the first dorsal interosseous muscle and the cleft between the first and second toes, as you can see here. So the cleft, if you face this in a practical exam, the cleft between the first and second toes is supplied by the deep peroneal nerve, while the other clefts supplied by the superficial peroneal nerve. Remember that. Okay, this is deep peroneal, the rest is superficial peroneal. Okay, on the medial side is the saphenous nerve, on the lateral side is the sural nerve. Okay, this will be the supply for the dorsum of foot as a whole. The superficial peroneal nerve between the extensor digitorum longus and peroneus longus, then it pierces the fascia to become superficial, supplies the skin of the lower leg, then divides into medial and lateral branches. Now please pay attention to this. It divides into medial and lateral branches. There are names for these branches. The medial is the medial dorsal cutaneous nerve of the foot, medial dorsal cutaneous nerve of the foot. The lateral branch is the intermediate dorsal cutaneous nerve of the foot. Pay attention to this. Okay, in American books, they name it this way: intermediate cutaneous nerve and medial cutaneous nerve. So what's the lateral cutaneous nerve? It is the sural nerve. Okay, so the lateral dorsal cutaneous nerve is the sural nerve, which is not a branch, of course, of the superficial peroneal, but the medial dorsal cutaneous nerve and the intermediate dorsal cutaneous nerve are branches of the superficial peroneal. The medial branch goes to medial side of big toe and second cleft. The lateral branch, or the intermediate dorsal cutaneous branch, to the third and fourth clefts, as you can see here. Okay, third and fourth clefts. This is the lateral branch, and this is the superficial peroneal nerve. Okay, this concludes our talk about the vessels and nerves of the extensor compartment. I hope you got the maximum benefit from this lecture, and thank you very much for watching.